Today we will discuss about miscarriage. What is miscarriage? It is a spontaneous loss of pregnancy before fetus reach its viability. It means the pregnancy loss before the 24 week of the gestation. There are the two types of the miscarriage: sporadic and the recurrent miscarriage. What is the recurrent miscarriage? It is defined as the loss of the three or the more consecutive pregnancy, those documented by the ultrasound or by histopathology. It affects 1% of the couple, 1 to 2% of the second trimester miscarriage before the 24-week. Incidence of the recurrent miscarriage is directly proportional to the outcome of the previous pregnancy. Recurrent miscarriage occur even there is no fetal chromosomal anomaly. Sporadic miscarriage, it is more commonly occur in the first trimester and it is most commonly due to the fetal chromosomal anomaly. Its incidence is increased with increasing maternal age. What are the causes of the miscarriage? Epidemiological cause, antiphospholipid syndrome, genetic cause, anatomical factor, which including the congenital uterine abnormalities, cervical weakness, endocrine factor, immune factor, infective agent, and inherited thrombophilia defect. What are the epidemiological factors that affect the pregnancy and causing the miscarriage, which includes the maternal age, number of the previous miscarriage, cigarette smoking, alcohol consumption, and obesity. Thrombophilia, acquired thrombophilic disorder, include antiphospholipid syndrome, presence of the lupus anticoagulant, anticardiolipin antibodies, and anti-beta 2 glycoprotein antibodies. Inherited thrombophilia, including protein C deficiency, protein S deficiency, factor V blooding mutation, antithrombin deficiency, prothrombin gene mutation, and methylene tetrahydrofolate reductase deficiency. What is antiphospholipid syndrome? It has an adverse pregnancy outcome, including 3 or the more consecutive miscarriage before the 10th week of the gestation, 1 or the more morphologically normal fetal loss after the 10th week of the gestation, 1 or the more preterm birth before the 34th week of the gestation, owing to the placental disease. What is inherited thrombophilia defect? Activated protein C resistance, most commonly due to the factor V bleeding mutation, deficiency of the protein C in the S, antithrombin 3, hyperhomocystinemia, and the prothrombin gene mutation. What are the genetic factors that are including for the miscarriage? Parental chromosomal rearrangement, example including Robinson translocation, reciprocal translocation, and inversion. What are the anatomical factors? Congenital uterine abnormalities and cervical weakness. Canalization defect, which leads to the septic uterus, and the unification defect, which including the unicornuate and the bicornuate uterus. And didelphys and septate bicornuate uterus increase the first trimester miscarriage. Arcuate, septate, and the bicornuate increase the second trimester miscarriage. Acquired uterine anomaly, which including the fibroid, submucosal, intramural, or subserosal, which increase the risk of the second trimester miscarriage. Endometrial polyp, intrauterine adhesion, what intrauterine adhesion leads. These are causing the constriction of the uterine cavity, lack of the sufficient amount of the normal endometrium that support the implantation and the placental development, defective vascularization of the residual endometrium consequent upon the fibrosis of the endometrium. The incidence of the intrauterine adhesions are increased due to the increased number of the miscarriage and the number of the DNC procedure. What are the infective agents that are causing the miscarriage? Toxoplasmosis, rubella, cytomegalovirus, and the herpes simplex virus. Cervical integrity, cervical insufficiency causing the miscarriage, most commonly second trimester miscarriage. Fetal chromosomal anomaly including the trisomy, aneuploidy, polyploidy, monosomy, euploidy. Endocrine factor, diabetic mellitus, thyroid disease when the TSH level increase more than the 2.5, thyroid antibodies increase the risk of the recurrent miscarriage, and the PCO also causing the recurrent miscarriage due to the insulin resistance and the abnormal glucose tolerance test. Elevated free androgen index is the prognostic factor for the subsequent miscarriage in the woman with the recurrent miscarriage. Prolactin imbalance also seen in the patient having the recurrent miscarriage. What are the immune factors that are causing recurrent miscarriage? The absence of the maternal leukocytotoxic antibodies, the absence of the maternal blocking antibodies in the natural killer cells. What are the malfactors that are including for the recurrent miscarriage? The contributing factor, malfactor to recurrent miscarriage is DNA fragmentation, nuclear chromatin decondensation, and the sperm aneuploidy. The sperm DNA fragmentation is mostly due to if the male drink excessive alcohol consumption and smoker, or if he is